families do to stay healthy this winter?
You know, there's a lot of things that families can do to try to stave off some of the viruses that we see causing the cold and flu. In particular, you know, trying to avoid by washing your hands. You know, I think we forget about the importance of doing that at those key times, especially as kids are coming home from school or daycare, or as we come home from work. A great time to make sure we're preventing the spread of those viruses. Also, as we get cooped up in our home, sometimes we forget about getting adequate exercise. You know, you hear that all the time, but it really does help the immune system. And then our diet can be very effective too. You know, cutting back on some of the sugar can boost the immune system, and then increasing vitamin D. You know, we don't see as much sunlight during the winter months, and so making sure either we're getting it in the diet or adding in a supplement of vitamin D can be very effective at reducing the incidence of coughs and colds. And
do you have any advice for parents whose child gets sick?
Yeah, you know, it's always hard in knowing what to do for a child. Certainly, when they get cold symptoms, trying to keep the airways clear can be key. And so using a good nasal saline spray in the very young children, even following that with the bulb syringe to try to help clear out some of the mucus. Hydration is very important, also to keep our bodies healthy and to thin the mucus so we can get rid of it. And then controlling the cough. You know, that's key to help kids rest and recover. And so using you know, a natural cough remedy. You know, we use the buckwheat honey in our Zarbies, which has been clinically proven to be more effective than the traditional cough medicine. All of those things can help those kids when they get sick.
And when is it safe for children to go to school, and when is it best for them to stay home and just recover?
You know, I've tried to put together some stoplight tips, you know, for this, and really the red light, you know, once when they've got the fever, they should be home. Once the fever's been gone for about 24 hours, okay to go back. When the cough is lessened less than a few times an hour, probably fine to start sending them back. Looking at the green mucus and excessive runny nose, we want to see that clear and be going away. And then also energy level. When the child looks sick, you know, they should be at home, but as they start to perk back up and show that energy level, recovering, they're typically okay to be, you know, back at school.
The FDA has put many traditional cough and cold medicines under scrutiny and deemed them unsafe for young children. Has this changed the number of visits to the ER?
You know, absolutely. This was a great ruling by the FDA. It dramatically reduced the incidence of problems, you know, and with overdose and the misuse of these medications. What we've found is that they really are ineffective in kids, and knowing that they're potentially harmful, we shouldn't be giving, you know, cough medicines to young children. And this was an issue that I felt passionate enough about to want to, you know, create a solution for my own patients as well as my own children in putting together, you know, the Zarbee's cough products to help provide a solution where, you know, many of these things have been deemed harmful.
And do you have any additional tips or information you'd like to share with us?
You know, I try to put some, you know, tips on my website at zarbies.com. Great ways to keep our families healthy and to keep us from, you know, needing to get to the doctor, you know, when we can. But also, you know, tips there to know when to go see the doctor, so you can check those out at zarbies.com.
Well, thank you so much, Dr. Zak. I appreciate it. Have a great weekend.
Thank you. You too.